Welcome, everyone, to the Tuesday, October 20th, 2020 Board of Commissioners meeting. This is Chair Catherine Harrington, who forgets to turn her microphone on every single week. So, roll call, please.
The Board of County Commissioners in Washington County, also serving as the governing body of clean water services and all other county service district, is now meeting in regular session, October 20th, 2020. Commissioner Willie.
Here.
Commissioner Rogers.
Here.
Commissioner Treese.
Here.
Vice Chair Scouten.
Well, this time I have my mic on as well. I'm not always that great either on that, but I'm here.
Chair Harrington.
Here. Yes, we do try to minimize the amount of paper shuffling and whatnot that you all have to endure due to our microphones. So the first item on our agenda is oral communication. Before I shift it over to the board clerk, I just want to note that in the 2 weeks since our board meeting, the last 2 weeks, we've received 29 different emails. Our team does a great job of helping us stay on top of emails and making sure people get accurate information in response. We've had 10 people send us input with regard to the handling of the new coronavirus, 4 with regard to racial justice, 9 on a whole variety of topics, 3 related to land use and transportation, and 3 related to elections, which is part of our assessment and taxation department. So, Kathy.
So we have public testimony that is specific to Ordinance 869. So we'll wait for that public hearing portion.
Yeah. Okay, so none general. Okay, terrific. Next, we'll move on to the consent agenda. Today's consent agenda consists of 17 different items, 2 sets of minutes, 4 items under clean water services, 5 items under land use and transportation, 1 item under health and human services, 1 item under juvenile services. There are 3 items under support services, and the first item, item L, was revised and updated through the packet releases compared to when it was first published. And there is 1 item under service district for lighting. What are the wishes of the commission?
Move for approval, Madam Chair.
Second.
We have a motion and a second to adopt today's consent agenda. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you, colleagues. There is one other agenda announcement I'd like to make, and that is we have pulled one of the topics for public hearings off of the agenda. That is item 5E, which related to some personnel rules and regulations. That will come to us at a future date. So next, we're going to move on to presentations. And our Director of Health and Human Services and one of our epidemiologists is here to give us an update on this new coronavirus, COVID-19. And I want to say thank you for coming and continuing to expand the knowledge of all of us based upon your expertise and what you're seeing in our community. I'm thanking you in advance for a job well done because you've just been doing a terrific job for these last 7+ months. So welcome.
Thank you. Good morning, Chair Harrington and Board. Marnie Kyle, I'm Director of Health and Human Services. Very happy to have with me Dr. Kimberly Repp, our Chief Epidemiologist in Public Health today. So we're going to let her kick it off, and I'll close the presentation with some of my normal updates on where we are with some of the strategies. So I'll turn it over to Kim.
Thank you, Marnie. Commissioners, as your Chief Epi, I would like nothing more to tell you today that things are back to normal. Today is not that day, unfortunately. And see the next slide, please. So looking at an overview of where we're at right now, this is simply our cases over time. The red arrow indicates where we went into phase 1. And as you can see, we had a nice big bleep and it looks like we're climbing up another one now. So this is from the very start of the epidemic in February to about 2 days ago. Next slide, please.
Excuse me, that was Washington County, correct?
Yes, ma'am,
thank
Washington County. So looking between the 12th of October and the 19th of October for Washington County specifically, how did our cases change? We had some more confirmed and presumptives. Our hospitalizations went up a little bit. Unfortunately, we had 3 deaths. And as expected, our outbreak numbers also went up across long-term care facilities, workplace facilities. Next slide, please. Now, I brought this slide last time I was here because with metrics, it's very important not to just look at 1 week because they fluctuate so much. So what you're looking at right now is phase 2 for all the indicators for Washington County over time. That top line is when we started in May. These numbers honestly don't matter. What you're looking at is red versus green. We want all green. So as you go down from September to October 10th, you can see our percent increase in new cases. The second column is red, and it's been red for 4 weeks. Our sporadic cases have been red for 5 weeks. Our hospitalizations are bouncing between going up and down, and that's pretty consistent with the rest of our sister counties. One thing that we've consistently nailed every time is our following up with our cases within 24 hours. I'm very happy to see 100% on that last week. So this is basically our snapshot of where we're at in the moment for Washington County in terms of the phase 2 metrics. So we are failing 4 out of 6 of them. Next slide, please. So let's look at our partners here. So in Washington County, Clackamas, Multnomah, and the Tri-County. Again, all we're looking at here is red versus green. We're at the top, because we should be, and you can see that we have 4 reds and 2 greens. Clackamas has 2 reds, Multnomah, I think this is the lowest number of reds that they've had that I remember ever. And then Tri-County, because we're all joined together, whether we like it or not, it looks like overall the county, we're failing 3 out of 6 metrics. So again, these change from red to green every single week, but consistently as a region, we're having an increase of cases, an increase of sporadic cases, and an uptrend in hospitalizations. Next slide, please. Now, everyone knows Oregon Health Authority has a naughty list, which they call the watch list. And what this is basically if your sporadic case rate, so the number of cases divided by the population that are sporadic, gets over 50 per 100,000, you get put on the watch list. As you can see, Washington County, the last column, is all green. We are good to go. We are nowhere near getting on the watch list. So those numbers that were 23, 26, and 30, they would have to get up to 50. So we're looking good on that. Next slide, please. School metrics. Well, we're not alone. So these are the indicators that the state uses to determine, opening of schools. And as you can see, you have to have fewer than 10 cases per 100,000 for 3 weeks in a row. Not a single county, Washington, Clackamas, nor Multnomah, has met that. Again, you see the numbers are in the 40s or 50s. It has to be below 10. The other column is the test positivity. Now, we've come the closest of flirting with possibly passing that. Like you see a 5.1 and a 5.2, it's getting closer, but our sister counties are not near there. So no one is nailing the school metrics at the moment. Next slide, please. Okay, this one is very fun. So is SARS-CoV-2, the virus causes COVID-19, is it airborne? That's all over the news, right? That is the biggest question. Everybody is freaking out about it. So let's talk about what that means and what that doesn't mean. Next slide, please. There are 5 main modes of viral transmission. So every virus has a mode or multiple modes of transmission. So direct contact with bodily fluid, vector through a mosquito, for example, a vehicle like improperly cooked Thanksgiving turkey stuffing, droplet transmission, which we all think of coughing and sneezing, and then finally airborne. Next slide, please.
Could you answer a question on that?
Yeah, absolutely.
You went back to that one?
Sure.
When you're saying vehicle, there's been some commentary that the virus can live on surfaces for periods of time, but you describe vehicle as food related.
So a a vehicle is anything that is not alive that can transmit disease.
So you weren't specifically narrowing it to food. It could be anything. It could be a microphone.
Yep, it could
I
be
touch and then you touch.
Yep, absolutely,
I see,
but
okay.
not a living creature.
Okay.
Or insect or.
All right.
Yep. Thank you. So what differentiates between all these different types of transmission? So an aerosol is any collection of particles suspended in the air. That could be spray paint, it could be hairspray, it could be anything, it could be dust, anything that you put in the air is an aerosol. So when we start talking about viral transmission, we're talking about the size of the aerosol. That's what makes the difference. So when you have large droplets, they fall to the ground immediately. They're big, they're heavy. If anybody's interested, usually greater than 100 microns. So those fall, they're wet, and they stay there. Small droplets, they will go out 2 or 3 feet, and they'll fall to the ground, also wet, they're not evaporated. So airborne particles are when the water evaporates and it just leaves the virus nuclei to float around in the air for hours without requiring circulation. So measles is one of the most contagious diseases in the world because its primary mode of transmission is airborne, okay? Next slide, please. Let's look at a visualization of this. So if the first person there is the infected person, he or she may cough or sneeze. We've all coughed or sneezed. When you feel the wet droplets on your skin, those are large, heavy droplets that are falling to the floor quickly. The small droplets are the mist. They're going 2 to 3 feet away. You can still inhale those. And as Commissioner Rogers said, it could be on a table, it could be on anything that lands on any surface. Now, no one is questioning that SARS-CoV-2 is transmitted via large and small droplet. There is no discussion about that whatsoever. It's obvious. The question is, can it be airborne? So can it reach the third person on this diagram? Now, there's a lot of research that says, yes, it can. They have found it floating in hospital wards for 3 hours in the air. But I'm going to tell you, as your epidemiologist, that it doesn't matter. Next slide, please. The reason why it doesn't matter is because the primary mode of transmission is not airborne. It may be able to be airborne, sure, but it's not its primary mode, because if it was its primary mode, we'd all already have it. It would just be an astronomical takeover of cases, and that's not the case. So sure, it might happen in certain scenarios, but the bottom line, the public health messaging around that is the same. The fewer people you have together, the better. The more distance between the people, the better. The more you keep your hands out of your mucous membranes and mouth, the better. And of course, the more you are covered, the better. And so that is your public service announcement from your friendly local epidemiologist.
So would you respond to an indoor versus outdoor environment on the more distance, the better? I mean, everything else, the fewer people and everything else I get, but we're told that outside is much safer than inside. So is that consistent with this?
So yes, the same things apply. Now, outside gets us a couple advantages that we don't really have indoors. So what we know now is that SARS-CoV-2 dies very quickly in sunlight. And I mean fast, any level of sunlight. So just being outside, we're getting that extra sort of killing power, if you will, of the virus just from being out in the light. That's not enough to stop a droplet before it gets in your mouth, but it's certainly good for surfaces and those and floaty, quote unquote, airborne sort of virus particles. Now, if you can be 6 feet away, I mean, the official messaging for mask guidance outside is if you can maintain 6 feet away, you don't need a mask. Now, I would caution, if you're not taking wind direction into account and someone coughs, it's actually going to make it worse, right? Because things travel more with the air current. And if you're downwind from someone that's coughing without a mask, it's not going to matter that you're 6 feet away. It's not going to matter at all. So I would kind of consider the ventilation or the wind and that kind of thing. Like if it's a still day, fine. But if you have Oregon wind everywhere, I'd wear a mask just to be safe if it's not an immediate household member.
Okay, thank you.
Thank you.
Okay, great. We're going to switch gears just a little bit. Oregon last week released a key survey, some findings from a key survey that they had done, and I thought they were really interested and that you might be interested because we've talked a lot about how well our state is doing. And so some of this really shows that our state is doing really well with a lot of the recommendations. And it also points out that we have some work to do. So, so you can see that about 4 in 10 Oregonians are very worried about COVID-19 situation in Oregon. So, and this was released a couple of weeks ago. Half as many are very worried about getting sick with COVID as in the past. And more in the Latino community are very worried about COVID-19 and very concerned about getting sick. And that makes sense when you look at what's happening to our Latinx population. They are getting COVID-19 more often and getting sick. In general, participants from the Latino community were more worried about others, their friends and family, getting sick with COVID-19 than about themselves. And this was especially prominent in the young Latinos between 18 and 24, when 7 in 10 stated that they were very worried. And I wanted to bring this one forward because I think we hear a lot about our young people not caring about others, and this survey really points out that in the Latino community in particular, they are very worried about their impact on others and wanting to protect them. Next slide. So 50% of, or this now moves to what are we doing to protect ourselves? And you can see 51% of Oregonians attended 3 or fewer social gatherings in the last 2 weeks. So most people, 51%, are trying to reduce their number of social gatherings. And small social gatherings are more common than gatherings with 10 or more people. So 66% reported getting together with just a few family members or friends from outside of their house, or doing that outside. 52% said that they did that with friends or a few family members indoors. And then 20% reported attending a social gathering with 10 or more people. So on average, Oregonians are taking personal protective measures most of the time. This was really good news. 84% wear a face mask indoor, in public almost all of the time, and 75% reported more frequent hand washing. So those are really make us feel like there's a lot of hope that if we continue to do these, reduce our social gatherings, wear our face masks, wash our hands frequently, that we will continue to move towards reducing case numbers. Okay, next slide, please. So I'm going to move now into the just the updates on our some of our key strategies that you all have been interested in. So this is just the updated numbers. The hotel voucher program has served 39 people that are currently enrolled. And of those, 13 have exited the program, and 62% of those exited into housing. So I think this is just a fabulous, and you can see on the Family Promise, that we've had 102 people that were enrolled, and 72% of them have exited into housing. So for me, this was a really positive unintended consequence. I mean, we knew that we would be able to help people hopefully find housing, but these numbers are really fabulous. We also have the Safe Sleeping Village is still open, And because the weather is beginning to turn and because we have more space in our respite center and we have protocols in place and staff in place now, we're beginning to move people from the outdoor camping, safe sleeping village into the respite center. And as that happens, we may be able to house some of the folks that are left at the safe sleeping village inside the Cloverleaf. So we're working with Leah at the fairgrounds with our public health staff to make sure that we can do that safely and maintain the COVID protocols as we do that. So that's happening. Our RV safe sleeping is up and running now, and we have registered 24 RVs or cars because we did allow people who were sleeping in their cars to remain there. Just not tent campers. They were either moved to hotels or the safe sleeping village. And within those 24 RVs and cars, it was housing 30 individuals. And then also, we are making a lot of progress. Annette, who's I think back there still, is making great progress in getting the winter shelters ready and to open on November 15th. So as an example of how fabulous these programs are and the good work that they're doing, I did want to share one story with you that came from Tiger Police. Go ahead.
Could I just ask what do the numbers include children? And how many children are in these different locations? Do you know?
I don't have the number of children. I know that some of the folks that are housed in hotels are families, and they do include children. But I can start.
Just curious.
giving
Thank you.
That. Yeah, and I don't know. Yeah, if we can get that to you though. So this is a story, and this was a family served through the hotel voucher program. So Tigard Police referred a family that had been living in the parking lot of Babies R Us. And what we learned about this family is they had been living in Talent, Oregon, and were impacted by the fires and had to evacuate and leave because of the fires. The child had not been able to attend virtual learning because the family couldn't get access to Wi-Fi. The family was provided a voucher into a hotel room and shared repeatedly how much they appreciated it. And when one of our staff checked in, they were really brought to tears because there was the mom really helping her 7-year-old catch up on his virtual studies, and the husband was able to go and start looking for work. So it's just a great success story that I wanted to share with you. And thanks so much, Annette and her team, for what they do. Okay, next up. He's on, he knows this by now. You could give this, Michael, by now. Executive order compliance. We do have a new reopening tool that was released on the 15th. I think that it's really been helpful for our staff as they work with businesses and provide new information. But just to be clear, indoor ice skating and bowling is still not allowed in phase 1. But the governor did loosen some of the restrictions that allow outdoor recreational and sporting activities in the updated guidance. Okay, school-age learning support. The child care grants, we have now verified and provided funding to 700, I don't know what that was, 272 verified applicants. We have released 3.3 million has been allocated, and we're continuing to review applications as they come in. And we continue to have conversations with Community Action about how they can help some of these, especially culturally very specific providers who may not have English as their first language, how we can help them not just apply for this funding, but first just to get licensed so that they can provide those services. And then an update on the on the learning support program. All of our school districts are participating now. Beaverton has the IGA in hand. We anticipate that it will be signed any day. And then I just wanted to give you an update that a lot of the schools, what they found is because we're all trying to play catch up with COVID since February. And so what they found is parents are pretty resourceful and resilient. And so a lot of them had already found some services to help with school learning, but we're really struggling with the finances of that. You can imagine if it's $300 or $400 and you have 2 or 3 kids, you can imagine the financial burden for some of our families. And so what they've done is they've implemented a hybrid model where they're actually reimbursing the families for the service, the learning support and childcare that they're in addition to developing these on-site. So they're really trying to meet the expectation of really trying to reduce the learning opportunity disparities within our families and help get parents back to school. So the schools and the public health staff are really being resourceful and figuring out how to do that with the committee. And this Kim covered really well. We are still tied regionally, and she covered the metrics earlier. So the other thing, I know, we're all really, really, really sick and tired of COVID. And we hear that from the public. We hear that from you all. We feel it ourselves. We know everybody is really tired. But I wanted to say, there is some hope. Even if the vaccines aren't in all of our arms in the next couple of months, we know that if we do these 5 relatively simple things, that we can reopen sooner. And so I know it sounded discouraging in the past and our numbers are discouraging, but there is a lot of hope. And these are things we can do, and we all know them. We can all recite them, wearing our face coverings, and we talked about that this morning in work session. Thank you, commissioners, for supporting that. Physically distancing whenever it's possible. Being outdoors is better than being indoors. Frequent hand washing. And this is the tough one. I know this is the tough one for a lot of us. Limit physical social gatherings with non-household members. So we can find other ways to reach out to our friends and families and loved ones. But we do need to try to limit the physical connection with people outside of our household. And with that, I'm happy to answer any questions.
Commissioners, questions or comments? Commissioner Willie?
Yeah, I think I read in the Oregonian on Sunday that they think that there's almost more unreported positive cases than there are reported positive cases. Could that be true?
Well, that would be, so lots of people get influenza and they don't get tested or they don't get prophylaxis for influenza. So it is possible that there are many people who have had COVID and they recovered at home in isolation and didn't go get tested. Just the same with any other viral illness. Now, to say it's equal to the amount of cases, that feels like a bit of a stretch because it would have to be so low of a severity of disease that no one went to the hospital, that no one died, and that seems unlikely with those kind of numbers, quite frankly.
And are we able to differentiate between somebody who just has the flu? I mean, does anybody have the flu anymore, or is everything COVID?
Oh, yes, it's already here. 0.2% of our ED visits. So, yes, we
Say
do
that
have different
again?
tests.
Say that again?
The flu has already started to
the
show up
percentage you
in the
gave.
hospital systems. I'm sorry?
You said 22%.
0.2.
Oh,
Okay.
Sorry, no. So yeah, when we
22,
actually started with COVID and we first had the test, you had to get tested for influenza and COVID, both at the same time. I don't know what the feds will do, but I'm betting once we get knee deep into flu season, I would imagine we'd go back to dual testing again. because there is something we can do for influenza.
Okay, thank you.
Can you forecast, and I know it's a wild forecast, when you think we may be in phase 2? Because my particular district, I'm taking a lot of calls in regard to particular businesses who are unable to open, and they just can't sustain, a lot longer, if at all. And so it's going to get nastier before it gets better, and I understand the science, but is there any hope? I mean, every week we keep hearing we're in the red, and it's not your fault, it's not our fault.
No.
It just happens, but
So it's going to get really bad with flu. So I would, as soon as we get influenza mixed into this, it's going to get a lot worse. Once we get out of influenza season, so that usually, is pretty much done by February, we'll have a much better idea of where we're at. But this is either going to be the best flu season we've ever had in this country because everyone's wearing masks and already distancing, or it's going to be worse because people will have both infections. So I wouldn't count on it before the end of flu season, definitely, especially if we're still using these metrics to make those decisions.
So I think Chair Harrington mentioned this morning at work session that the public health administrators and public health officers have presented some proposals to OHA that we're working on that I wouldn't say that it moves us into phase 2, but they are some strategies that would allow us to, I think we were calling it kind of phase 1.A. So that would allow us more flexibility in how businesses open and maintain safety, that would help us to move towards being able to have some more in-person learning. So there's a proposal that you should be getting. We're going to get you information within the next couple of weeks. And then I think that we were planning the 27th, is that the Tuesday?
Yep.
That we were planning to do a work session to specifically share those ideas with you and where we are in the negotiation conversation with OHA at that time.
And you're right to point out that there are our public health experts and public health officers have been talking about how there are different theater configurations, different bowling alleys that are totally committed to the whole ventilation, sanitizing, making sure that people wear their fabric face coverings, have sanitization solutions, do the distancing thing, and feel like they're trying to do everything right, yet they're still being excluded from the capability. So a lot of discussions to figure out how we can both continue to make the case at the state level, but ensuring that the state is providing for reasonable accommodations for that.
thank you for that, because there comes a point where we have to decide, because we're asked to, we're not being blamed, it's not our fault, it's not our rules, but where's our advocacy to look at those unique situations? And if you're on your knees financially, even if you only got 10% or 20% of your normal revenue, it's better than zero, and maybe you can last another month or two. But to continually say no and not advocate, it puts it back on us instead of where it needs to be at the state level. And so, anyway, that's my point.
And Commissioner Rogers, the last thing I think any of us want in Washington County to have is Walmart and Amazon only left. Like, what makes our county so beautiful and unique are all those family businesses, and we need to do everything we can to support them.
Agreed.
Thank you for your presentation, for always keeping us up to date. You did not cover the changes in the guidelines for mask wearing by the governor. I was just checking to see what they are. If things like the recommendation is that the face shields are not a substitute.
Yeah. No.
For masks, and the masks should be worn in public settings at all times. So I would just ask for a review of those.
Sure. So the new mask guidelines I think a lot of us are already doing most of it anyway, but basically any indoor setting, you're supposed to have a mask on if there's any interaction with the public. Basically, the only way you don't wear a mask indoors is if you have a completely private space that has no interaction with other people. Other than that, it's wear a mask. For outdoors, the best practice is to wear a mask. However, if you can maintain 6 feet of distance in an outdoor situation, the mask is not required. There's no 6 feet indoors anymore. It's wear a mask unless you are completely isolated.
Commissioner Scouten, any remarks?
No, it's just going to be a long haul. And it has been a long haul. And things are going to get worse, I think, for a while. It's terrible in other parts of the country. Do you have any sense of where Oregon's going to be and where Washington County's going to be relative to those other parts of the country? In
Honestly,
2 months, 3 months?
Oregon is doing really, really, really well. Like, we're in the top 5 in terms of low case counts. We're sitting pretty compared to the overwhelming majority of other states. And I mean, it's still, we're having a lot of loss and illness, of course, I'm not minimizing that, but Oregon is doing outstanding relative to other states.
And we can bring back the map next week. I think next week is another presentation, so we can bring back that map that compares kind of our case per 100,000 with our neighboring states in the nation.
And Washington State and California are similar to us. It's basically the South and the East that are lit up bright red for high case counts, excessive deaths, those kind of things, so.
What do you attribute that difference to?
Boy, wouldn't that be interesting? That's a billion-dollar question. So we know it's how it's transmitted, right? Droplet transmission. We know that there are some jurisdictions in states that have actually banned wearing a mask. So whatever they're doing, they're not reducing droplet transmission in some form or in many forms.
Okay, so I'll make some comments. I first want to say thank you to our legal team for ensuring that all of the different contracts that are needed for these different community services are happening. The other thing I'd like to say is to this message of hope. Yes, folks, we are entering a 4-month period, November, December, January, and February, where it will be darker. The weather forecasters tell us it will be likely wetter and colder than we've been experiencing these last 7 months. You know, it was wonderful. We had a nice, long, prolonged spring. People have rediscovered walking outside, and you got to see different blossoms and, you know, different buds on different plants at different times. Well, the next 4 months are going to be different than the prior 7 months with regard to our external environment. But we can do this. There are very prudent steps that we can take, and some of them pretty darn creative. Our public health team has illustrated the 5 very prudent things. The wearing of the mask all the time, being careful around other people, and so forth. Getting a flu shot, please, everyone. I'm someone who doesn't like needles. I don't care for taking medicines, but I've made darn sure to get my flu shot this year because it's the caring thing to do for one another. I want to make sure that I'm not contributing to the problem. So I'm taking that, or have taken that proactive step. We're trying to ensure that everyone has the opportunity of proper flu vaccinations. But please check on your neighbors. Please subscribe to the daily email from the Oregon Health Authority. They've had a great series on how to enjoy autumn activities, including trick-or-treating or Halloween experience in a safe manner. Let's put our creative thinking caps on. My friends and I are getting creative about just having gatherings of 4 of us, for example, in a garage that is well ventilated, making sure we're someplace dry, right, with Oregon rains, but making sure it's well ventilated to increase our healthful situation. We can do this. We can help ensure that there is less impact than otherwise. You know, being patient at the grocery store between customers to make sure that surfaces are clean and that the checkout clerks are able to take care of themselves. Those things make a huge difference. We're all people. We're all individuals. Let's help us through this. We will get through this. Yes, some of the numbers will be bleak, but we can help one another through this and make sure that we each know there is always hope. And if you need a helping hand, we have resources to help you with that. You are not alone. We will get through this. Thank you for listening to my soapbox of the day. Thank you, team, for keeping us informed and for making this information easily publicly available.
Thank you.
All right, we have one more presentation, and it's from our Clean Water Services team. A member of the organization has been recognized through the Tualatin River Keepers with the Green Heron Award, and we want to make sure to provide a spotlight opportunity on that. Well-deserved, well-earned, and we're very proud of you. So I'll turn it over to Diane and Mark Jockers.
Thank you very much, Chair and members of the Commission. My name is Mark Jockers. I'm the Government Public Affairs Director with Clean Water Services, and I'm just here largely to introduce Jan Wilson, who's the Executive Director of the Tualatin River Keepers, who will join us virtually, who is going to talk to you a little bit about the award that Bob Baumgartner, who's sitting to my right, our Regulatory Affairs Director, received at their virtual gala last month. So with that, I'm going to go ahead and ask Jan to pop on Zoom here with us, if you can promote her.
Hi, Jan. We can see you, but we can't hear you yet.
Okay, I think I'm unmuted now, right? And you
Yes.
guys have my beautiful, so I'm in my car. I'm out in Forest Grove today. Thank you very much. I'm socially distancing. We're outdoors and doing some field work today. And I wanted to join you to let you know what we have done for this year, our Green Heron Gala at Tualatin River Keepers. As you probably know, it's usually held in person. In April, we had to delay that to September, and then it had to go virtual. And so we didn't get a chance to honor in person Bob Baumgartner, who's our Green Heron Award winner. But we did it with a video because that's how we're doing everything this year.
Yeah.
And so Mark has queued up the video for us, and Bob's sitting there. We've already met with him socially distanced and with masks and whatever to give him the award, but we wanted to share that with you because he's done such a great job for us and really furthering our mission of protecting the Tualatin River, which goes right through all of our community. So I wanted to thank you all for recognizing Bob. I wanted to let you know how we've recognized Bob. And Mark, you want to cue up the video?
Thank you, Jan. I'll go ahead and ask staff to play that video now.
We're working on it. Thank you.
I can play it.
Point it over that way.
Yes, ma'am.
You're not seeing the video link?
Nope.
So we could go ahead and present the video once it's back through. If you want to take a pause and maybe do a video or a photo op.
Do that? Do you want to? I'll leave that up to the board.
I have no idea what the logistics are.
Yeah, I don't either. I thought we had the video. It's a 2-minute piece, but apparently the link did not come through, so.
I'd just simply say, Bob, congratulations, well-deserved. You and I have known each other a lot of years. You've always done outstanding work for CWS, and I guess this doesn't terribly surprise me. I mean, when good people do good work, they need to be recognized. So congratulations for people recognizing that.
Thank you. Chair Harrington, members of the board, and thank you very much for that. While we're waiting, maybe just a couple of words. I do want to tell you all I'm very prideful but very humble about receiving this award. I think it really reflects a lot on what our agency does. Thank you very much to the Jan Wilson and the Tualatin River Keepers, not only for the award, but for what you do for the basin and the community here. Chair Harrington, I want to really thank the board for your leadership. I think it's striking that, and does represent very well that a public servant can also be winning an award from an environmental group, and I think it reflects very well on the open and very positive public communication, public process that you guys have allowed us to do, and I want to thank Diane for her support and encouragement all along. A lot of people were involved in this, and really the work from our staff that has allowed me to be able to be successful. So thank you very much.
Yay. So I see that we have this video queued up, so I will go ahead and ask the clerk to play
The
that.
Walton River Keepers Green Heron Award honors a person whose work and actions in the watershed especially support the mission of protecting and restoring the Tualatin River. This year we've selected Bob Baumgartner, the Regulatory Affairs Director at Clean Water Services. Through his work at Clean Water Services and also for 20 years prior at DEQ, Bob has continually supported the Tualatin River Keepers mission, and he's aided our staff whenever asked. He also provided increased bacteria monitoring in the summer months at our request when people needed to know immediately that the river was safe for recreational activities.
Technology is great when it works.
So what we'll make sure to do is ensure through social media that the video link is shared with a blurb about the award. I know that through the Green Heron Awards dinner and communication that I had the opportunity to view the video, and it does a very nice job of summarizing how over these many years Bob has stepped forward, practiced the art of the possible for the benefit not only of ratepayers but for our entire watershed and this river that carries drinking water to treatment plants or transports it, that takes cleaned sewage water and returns it to the Tualatin River, and all of the watershed enhancement programs and the regulatory compliance that the organization does through your leadership. So thank you very much for the work that you have been doing each and every day through your career. We've all had the benefit of it, and that includes the birds, the bees, the trees, and we're very grateful for it.
Chair, I would like to offer the opportunity for Jan to say a few closing words if she'd like. I'd also like to point out that Clean Water Services has spent 50 years looking at how we reach beyond what the regulatory requirement is to really look to see what the environment needs. And Bob has been central to our ability to navigate that complicated issue, to balance the needs of the environment with our ratepayers and the needs of the utility itself. And I wanted to see whether or not Jan wanted to say any closing remarks, and I also wanted to apologize that we were not able to show the full video, but we will share it elsewhere.
You guys, can you hear me? Because I couldn't hear you for the longest time. Catherine's mic was muted.
Yes, Jan, we can hear you.
I'm sorry. I really wish this presentation would have worked. I will try and do it in person for you sometime, but I really I just want to say thank you very much to Bob for everything he's done this year and in many years in the past for his work to protect the quality of the Tualatin River, the water, the experience people have with this river, and I'm sorry that the technology didn't work out today.
So are we, Jan. But it doesn't diminish the prominence of the award and the well-deserved recommendation. So thank you very much to the Tualatin River Keepers for this.
Bob,
Thank you, Jan.
congratulations. It's an honor well deserved.
Thank you very much. Appreciate it. Thank you.
And next, we'll move on to two different proclamations that we have. The first is from Housing Services to proclaim October 18th to 25th as National Family Promise Week. And we would invite our staff to take us through this. Thank you very much. Annette Evans, take it away.
Thank you. Good morning, Chair Harrington and Commissioners. National Family Promise Week raises awareness that every child deserves a home and acknowledges the work of nonprofit and faith-based partners working to end homelessness for our families with children. Today, we are joined virtually by Rose Money, Executive Director of Family Promise of Tualatin Valley, Kathy Ayers, Chairperson for Family Promise of Washington County, and Jolene Guptill, Executive Director for Family Promise of Beaverton. These frontline essential social workers assist houseless persons at high risk for COVID-19 to access shelter, meals, case management, and housing navigation supports in a hotel-based shelter model. County CARES Act funds were appropriated in June to reopen the Family Promise shelters that closed in March when the Executive Order 20-12 asked the churches to close and for all of us to stay home, stay safe. The Family Promise agencies responded quickly to the need in our community by expanding their service capacity and their mission from serving 11 family households to more than 25 family and adult-only households, which includes many of our older homeless adult population. Since June, they have assisted 102 persons, with 72% of these clients achieving housing placement at exit from the shelter. As we join in welcoming and creating awareness in our community about the Family Promise shelters, I would like to invite Ms. Guptill, the Executive Director for the Family Promise of Beaverton, to share a few words.
Hello. Thank you so much, Chair Harrington and County Commissioners for doing this proclamation. And I want to thank you on behalf of our 3 programs, our almost 40 churches and organizations, and our thousands of volunteers that support our programs and the families who experience homelessness in Washington County. So thank you very much.
Thank you, Jolene. I just want to say again that Jolene is one of 3, and that the work that they are doing is life-saving for so many out there, and that their caseworkers, while they are trained in trauma-informed care, are really dealing with many different impacts in the people that are coming into their hotel-based shelters. The CARES Act fund does end the end of December, and we are currently working on other funding operations as we are concerned that our church facilities that provide overnight shelter will not be open, and we need to keep the capacity of the system to serve these individuals. So we will give you future updates on that. But thank you again, Jolene.
Move for the requested action, Madam Chair.
First, let's read the proclamation.
Well, I thought they would read it. Okay, we can do that. I thought that would kick off the reading. Okay, please.
All right, National Family Promise Week, October 18 through 25, 2020. Whereas the Washington County Board of Commissioners recognizes that homelessness continues to be a serious problem for individuals and families, and whereas Family Promise of Washington County opened in 1996, Family Promise of Beaverton opened in 2018, and Family Promise of Tualatin Valley opened in 2019, provide shelter and support services dedicated to helping the most vulnerable among us. And whereas the National Family Promise support numerous congregations of our faith community, which provide the facilities to house and feed guest families, thereby making a real difference in the lives of their neighbors in need. And whereas, believing that every child deserves a home, Family Promise shelters and more than 1,300 community volunteers empower families in making a transition from homelessness to sustained independence. And whereas, beginning in 2005, Family Promise began entering client data in the county's homeless management information system that reports Family Promise shelters have assisted more than 200 families on their journey from homelessness to housing stability. Whereas the purpose of the proclamation is to inform and educate the public about local homelessness and the Family Promise Giving Day on October 23rd, 2020. Now, therefore, be it resolved that on this 20th day of October 2020, the Washington County Board of Commissioners hereby urges citizens to recognize and raise awareness of the issue of homeless children and families in our community and proclaim the week of October 18th through 25th, 2020 as Family Promise Week. Be it further resolved that the Washington County Board of Commissioners encourages all citizens to recognize those people who do not have housing and need support from citizens and private, public, and nonprofit service entities.
So we have a motion to adopt the proclamation. Do we have a second?
Second.
Thank you, commissioners. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Were there any comments that any individual commissioners would like to make?
Great work.
Nope, just wanted to make sure.
Well, I just hope that we can find some federal funding going forward. There needs to be some ongoing and very substantial COVID funding to both help our business community as well as those who are impacted very severely as they are now by COVID and related matters.
And thank you, Ms. Gupta, as well as for Ms. Evans for joining us today. Thank
Yeah,
you
I'd
very
just like to say thank you too for those organizations that we've listed here that for standing in the gap. Thank you for what you do and how hard you work to provide a home for these families. So keep up the good work. Thank you.
I'd like to second that and say that thank you for the work that you do both during the pandemic and not during the pandemic. So I recognize that this is not just related to our COVID situation. So the work that you do has a long history and it unfortunately has a future as well. So thank you.
Thank you very much. Have a great
Thank
day.
you, and stay healthy. All right, we have a second proclamation today to proclaim October 2020 as National Community Planning Month in Washington County. So we have the Director of Land Use and Transportation Planning, Mr. Roberts, as well as a member of his team in person and perhaps some on Zoom. Take it away.
Yeah, so thank you, Chair. We just wanted to take this opportunity to ask the board to declare October as National Community Planning Month. That's sponsored by the American Planning Association and then their professional institute, the American Institute of Certified Planners. We do this each year, and this year's theme is actually planning is essential for recovery. So obviously, we're all well aware that there are many needs out there in our communities, and we want to try to be part of those solutions. And so I think that's really all I wanted to say. And then we do have a brief video that we'd like to share with you. And then if it's all right, I was going to ask Teresa, who's actually our community planning section manager, to read the proclamation. All right. just like to add, I think we have a really, this is just a good reminder, we have a really great group of really committed, passionate folks that really love the work that they do and do a really good job for us.
Great. Good morning again. Proclamation of the Board of Commissioners for Washington County for National Community Planning Month, October 2020. Whereas change is constant and affects all cities, towns, suburbs, counties, boroughs, townships, rural areas, and other places. Community planning and plans can help manage this change in a way that provides better choices for how people work, live, and play. And whereas community planning provides an opportunity for all community members to be meaningfully involved in making choices that determine the future of their community. And whereas the full benefits of planning require public officials and community members who understand, support, and demand excellence in planning and plan implementation. And whereas the month of October is designated as National Community Planning Month throughout the United States of America and its territories. And whereas the American Planning Association and its professional institute, the American Institute of Certified Planners, endorse National Community Planning Month as an opportunity to highlight the contributions sound planning and plan implementation make to the quality of our settlements and environment. And whereas the celebration of National Community Planning Month gives us the opportunity to publicly recognize the participation and dedication of the members of planning commissions and other citizen planners who have contributed their time and expertise to the improvement of Washington County. And whereas we recognize the many valuable contributions made by professional community and regional planners of Washington County, and extend our heartfelt thanks for the continued commitment to public service by these professionals. Now, therefore, be it resolved that on this 20th day of October 2020, the Washington County Board of Commissioners does hereby proclaim the month of October 2020 as Community Planning Month.
What are the wishes of the commission?
Madam Chair, I move that we proclaim October 2020 as National Community Planning Week in Washington County.
Second?
How about a month?
We have a motion and a second.
Oh,
Yeah.
okay.
We'll actually enjoy that week all month long.
Yeah, I guess we will.
Yes, so this month of October is Community Planning Month with the theme of planning is essential for recovery. Boy, we have 3 different crises that we're recovering from. This pandemic, economic crisis, as well as recovering from wildfires. I think we'll leave it at that. So we have a motion and a second. Are there any commissioner comments that you'd like to make as part of this? Commissioner Treese?
I enjoyed the video, but I really enjoyed the first part of it where you highlighted the different programs that you work on. I think that that was really, really good and really brought to mind things like Last Mile, the other things that we don't necessarily think about on an ongoing basis. So thank you for bringing that to our attention.
I would say at the time I've been on the board that this department, your department, has really become land use and transportation together in a way that wasn't true 20 years ago. I think we focused on transportation and kind of sometimes forgot about the land use aspect of it. But I think that the synergy and the deep relationship, I think, are really understood in a way that wasn't true 20 years ago, and I very much appreciate that.
Thank you. Thank you.
Any other commissioner comments?
We've always had great relationships with LUT, done great work.
I would just like to say that the emphasis is on the word community, that our built environment as well as our natural environment is on our shared planet, our shared communities. You've got a great team who continues to explore what the community needs to utilize new tools, best practices to help ensure that every single member of our community has opportunity to thrive here in our community. So we have a motion and a second to adopt this proclamation. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you, colleagues.
And just to be clear, because I'm talking clear to the staff, this is for the month, not just for a week.
Yep, good job. All right, we'll move on to the public hearings. So we're coming down to the end in our land use ordinance season. So the first thing we need to do is to read our engrossed ordinance by title only. Do we have a motion to do
So moved,
that?
Madam Chair.
Second.
We have a motion and a second. All those in favor, please vote by saying aye.
Aye.
Aye. Any opposed? Thank you, commissioners. We'll turn it over to Brad Anderson to read this by title only.
Hold on just a sec. Ordinance, A engrossed ordinance number 869. An ordinance amending the Rural Natural Resource Plan, certain community plans, and the Community Development Code relating to development in areas designated significant natural resources and land developments.
Thank you, Mr. Anderson. So we are here today to conduct the first public hearing on this engrossed ordinance. And to help us, there have been lots of moving parts, lots of community input, work done by our planning commission as well. So we'll start with a staff report first.
Thank you. And so, yeah, this will be your first hearing on the A engrossed ordinance, and I just want to remind the board that the action that we'll be requesting today will be to take testimony, continue the public hearing to October 27th, and then potential adoption on the 27th. So with that, I'll turn it over to Teresa and Michelle to do the staff report.
Great, and I will just turn it over to Michelle Miller, who will give the presentation.
Okay, welcome, Michelle. We see you.
Good. Good morning, everyone. My name is Michelle Miller, Senior Planner in the Community Planning section with Land Use and Transportation. We're here today for A engrossed ordinance number 869, amendments to significant natural resource regulations. Next slide. So the primary objectives for this ordinance are to address the Land Conservation and Development Commission enforcement order by developing clear and objective code language, especially as it applies to urban residential land use development. Maintain consistency with current County Goal 5 policy direction, provide clarity and transparency in the regulatory requirements, and focus on the urban unincorporated area. Next slide. Turning to the ordinance itself, I'll start with a summary of the filed ordinance and then talk a bit about the proposed changes for engrossment. The enforcement order required us to take a look at the Community Development Code Section 422, the Significant Natural Resource section, and revise the standards so that they're clear and objective. Because most of the county's significant natural resource standards were in place before 1990, they contain some subjective terms that hadn't been updated since the Goal 5 program was first developed. We are looking to clarify the land use submittal process with minor changes to the S&R categories and add to and clarify the submittal requirements. The existing narrow limited allowed uses and activities in water-related habitat areas remain the same, but some clarifications were needed. For upland wildlife habitat, the changes quantify the preservation area requirements, replacing the existing subjective mitigation language. We're adding an incentive to the plan development standards to encourage development projects to retain more upland wildlife habitat. And then there are some minor changes to the rural significant natural resource standards. Next slide. Based on a wealth of valuable public testimony throughout this process and with the support of the Planning Commission hearings, we made some changes to the originally filed ordinances that were within our narrow scope and objective by addressing standards that were not yet clear and objective and correcting some minor inconsistencies, wording, and drafting errors. Next slide. Next, To recap the timeline of this ordinance, it was originally filed in July. The Planning Commission has held 4 hearings with significant discussion. In mid-September, staff proposed changes to the filed ordinance in response to the comments received, Planning Commission input, and further review. The Planning Commission held an additional hearing on October 7th to consider the proposed changes before you today. After the testimony and lengthy discussion, the PC voted 5-2 to recommend approval of the engrossed ordinance. At the last meeting, the PC discussion highlighted the need to balance often competing statewide planning goals with some interest in stronger resource protection, recognizing that there were limits on regulating private lands, and expressed an interest in reviewing the habitat assessment guidelines. The habitat assessment guidelines will provide the methodology for performing the habitat assessments that are now required as part of the changes to the SNR standards. The guidelines are currently under development and will be presented to the board before the effective date of the engrossed ordinance, if approved. No development applications will be considered until these materials are finalized and approved by the board through a separate resolution and order. Next slide. The board has held hearings on this ordinance September 15th and the 29th. After the hearing on September 29th, the board ordered engrossment of the ordinance, directing staff to file changes to the original ordinance for further consideration. Engrossed ordinance number 869 was filed October 8th, and the board hearings are to be held today and next week, October 27th. Next slide. The timeline for the guidelines are a little different. As mentioned, the guidelines are being prepared. Because they will provide the technical guidance to the new standards, if approved, they will go hand in hand, and the intention is that they go into effect together. The timeline for their review will be a Planning Commission discussion of the draft November 18th and December 2nd, then a board briefing at the December 8th work session with board consideration of resolution and order adopting the guidelines December 15th, which will correspond with the effective date of engrossed ordinance number 869 if adopted. Next slide. At this time, staff recommends conducting the public hearing and then continuing the hearing to a date certain of October 27th for further consideration and possible adoption. And with that, I'll take any questions that you might have.
Commissioners, are there any questions at this time? Okay, seeing none, I do want to note that our board clerk has ensured that the commissioners have received the various emails from community members. And we will be opening a public hearing, excuse me, that is limited to 3 minutes for individuals and 12 minutes for a representative of a group. So to our board clerk today, who do we have?
First, we have Jim Long, who is representing CPO 4M.
Could you give us a brief summary of how many we're expecting?
Yes, we have a total of 5. This is the only one, the one with Jim Long, that will be representing a group.
Okay, great. So I'll open a public hearing, and Kathy Jacoby will handle the logistics.
So Jim, I have you up first, if you'd like to go ahead.
Jim, can you hear us?
But we're doing that. I didn't remember a group had 12 minutes.
I don't remember that either.
Where did that come from?
I believe it was 5 minutes.
5 minutes is what
Yeah.
I'm just reading what's here
Yeah.
on the paper. So, Jim, you'll have 5 minutes. Can you hear us?
I can hear you. Can you hear me?
Yes, sir, we do. Go right
Okay,
ahead.
I actually had not signed up to testify today. Our CPO doesn't meet until the 28th, and that's after your next public hearing. So we haven't actually had, as membership, an opportunity to consider the engrossed ordinance. So I will be coming back perhaps after your next hearing with our input. But taking a look at it, it looks like the title that was read was quite vague. I mean, it talks about certain community plans, and why doesn't it specify just exactly which community plans this ordinance would affect? I think that to be vague and not clear and objective. otherwise, one of the things I was asking for at the Planning Commission last week or the week before was to see the actual comments, see what was presented to the Oregon Department of Fish and Wildlife about this ordinance, and to actually see what their comments are. We want to get those comments on the record. So those are my comments for the day, and I'm done. I'd be glad to provide. I'd be glad to take up the rest of the time next week. You're hearing. I don't know that I can do a whole 12 minutes, but I'll do at least 5. Thank you.
Thank you, Mr. Long. We'll move on to
Thanks, Jim.
individuals.
Yes, so next we have Dale. Dale Feek, you've got 3 minutes.
Mr. Feek, can you hear us? We cannot yet hear you. Mr. Feek, are you there?
I am. Can you hear me?
Yes, I can hear you now. Go ahead, please.
Please, Clerk Kathy, don't start my time right now. I want to make a few statements first, not related to this public hearing.
Sorry, you do not get to do that.
Okay, I won't. I'll make it later. Okay, thank you. I'll start my public hearing for this hearing, okay? Chair Harrington, Commissioners, I'm Chair of Washington County Citizen Action Network, a group. So I assume I get 5 minutes, but
The clock is ticking. You have 2 minutes and 41 seconds.
Good, thank you. I'll make it quick. I sent you WCCAN sent you comments on December 31st, 2015, 2019. Also redid it October 20th. I'll just emphasize a couple points on this 3-page public comment that we did before. The planet is currently experiencing the 6th mass extinction. A report by the World Wildlife Fund and the Zoological Society of London found that average species abundance of global populations has declined by more than 60% since 1970. This report stated that habitat loss and degradation were the leading cause of species extinction. We encourage staff and commissioners to view this process not just as a reaction to complaints and LUBA rulings, but as a proactive response to species extinction and a need to protect our dwindling wildlife habitat. We note that many of the weaknesses cited in the analysis of the various options are based on increased burdens on staff resources. We request that a budget increase for LUT be increased. And then there are 8 responses. I'm just going to emphasize one of them of the public. Now it's hearing testimony that we sent before. It's number 5 on our 8 points that we sent to you. The county's Goal 5 resources inventory is dated as it was completed 35 years ago. We encourage adopting option C. Not only is the inventory dated, the boundaries are vague, encourages developers to expand across the imprecise boundaries of some SNRs. This can be a multi-year phased project. Clear and objective standards will allow better data to be generated in future development site files. Use data from the FEMA update, LIDAR, Metro's Title 13 mapping, conservation easements, and approved land use applications with protected and mitigated water resources and wildlife habitat to improve mapping and inventory. So I want to thank you on behalf of WCCAN, Washington County Citizen Action Network, for consideration of our recommendations, comments, and concerns. So we're eager, WCCAN is eager to partner with Washington County as we go forward in this process. Very sincerely, Dale Feek, and also I listed the members of the board. Vice Chair is Greg Malinowski, former County Commissioner. Thank you.
Thank you, and we have received your information in writing. Who's next?
Yes, we have Greg Malinowski. You have 3 minutes.
3.
Greg, can you hear us? Greg, can you hear us? Greg Malinowski, are you there?
Yes. Can you hear me?
Yes.
Can you hear me?
We can hear you now. You have 3 minutes.
Oh, gee, the 30 sounded better, but I'll go with the 3 minutes. My name is Greg Malinowski. I am a vice chair at Washington County CAN and a resident of District 2. I just wanted to go ahead and there go my notes. I love electronics. But I wanted to go ahead and just say that while I am vice president, I'm not speaking for the board if we can. So I'm just saying what I've heard in meetings with citizen groups. There's a concern that this is a major policy change from what was written in our notes and written in the ordinance. A protection of approximately 3% of the urban area for wildlife. And the efforts to make it voluntary mean that we're changing from 3% to 0% potentially. The lack of the ability of the county to provide much information on how much of that 3% is left and to do an audit is surprising and dismaying. And a lot of folks consider this to be critical to the livability and the enhancement of lifestyle inside their communities to have this. I think we need a more thorough look at what we have left. Are we still committed to 3%? What do we do to replace that which was misplaced, if you will? Realizing there are limits to what you can do with private people on private property, but just because you're late for a dentist appointment doesn't let you drive 70 through a school zone either. And I think there are ways of mitigating it that some were suggested last year. Transferring density 100% from wildlife areas to buildable areas on the same plot that have not been properly researched. In any case, the community looks forward to working with you. We know this is a hard issue and a hard deal, but we don't necessarily want to go from 3% to 0%, which it appears this is doing. So we're looking forward to the chance to work with you next year. We've been told repeatedly this is a fix, kind of an emergency fix, and that next year will be another chance to look at it. And we're counting on the fact that, in fact, there's good faith there and that you will take another look at it next year. Other than that, we look forward to working with you and helping the community to work with you. That's what we're here for. So thank you for your time and thank you for this wonderful countdown here.
Thank you, Mr. Malinowski. Ms. Jacoby, who do we have next?
Next, we have Janelle St. Pierre. You have 3 minutes.
Ms. St. Pierre, can you hear us?
I can. Can you hear me?
Yes, you're all set. You've got 3 minutes.
Great. Thank you very much. I wanted to express my thanks to the commissioners for the time and thought that is going into this ordinance. I appreciate the effort by Washington County staff and particularly the Planning Commission. I've sat in on a lot of their meetings. For the time they have dedicated to listening to the community, they really made a lot of effort for that, and I appreciate that. Staff have estimated there's approximately 300 acres of identified upland habitat with the potential for development out of, I think, something like 1,500 original acres. Over 45% of the map upland wildlife habitat has already been developed. This small amount of upland habitat is a critical resource for both wildlife and communities. Protecting only 25% of this remaining resource has the potential to significantly degrade the resource and have really big impacts on the communities of Washington County. The new development requirements that we have with Metro right now tend to create very dense housing, and I mean, understanding the necessity for that, but it has really limited to no habitat value. In places where we used to have, neighborhoods with lots of trees and people had backyard habitat, we have houses on really small lots that often don't have room for any trees, or if they do, they're small street trees that really don't have a lot of habitat value. And pardon me, lost my train of thought. And that really limits kind of what additional value we have to the area. People need access to nature, and the upland habitat in areas is the most likely to be integrated with development and provide that access. Mature trees provide important habitat and temperature management. So staff have identified that 25% is a policy issue that they want the commissioners to look at. And I'm asking that this percentage needs to be increased. I understand the need to provide some flexibility for development, but it seems like we should be able to protect at least 75 to 80% of this small amount of remaining resource. We need to be able to have resilient communities that both protect natural resources and are resilient for climate change. It doesn't have to be kind of a choice of either or. There's an opportunity here for us to say, this is a really important part of the kind of future we want to have in Washington County. And I'm really asking, with all of the public comments and all of the time that people have put into this, that the board really looks at changing this percentage and having something that will protect the small amount that we have left. And thank you for your time. I appreciate it.
Thank you, Ms. St. Pierre.
Okay, we had a final person signed up, but I do not see him by name or phone number as logged in. So we are through with our public testimony.
All righty. So with that, I'll close today's public hearing, though I neglected to see if there was anyone in the room. Flag me down. Okay, seeing none.
Move for continuance, Madam Chair, to the 27th.
Yes, thank you. So we have a motion to continue today's public hearing to our next meeting, October 27th. We also have a motion from Commissioner Scouten. All those in favor, please vote by saying aye. Aye. Any opposed? The motion carries unanimously. So we'll be back at it next Tuesday, October 27th.
Great. Thank you.
Thank you, staff. Now we'll move on to public hearings for our Department of Health and Human Services. We have two of these today. Oh, excuse me, one from Health and Human Services, the other is Support Services.
Are we going to skip over the Southwest
Oh,
Home Road?
thank you so much.
Yep. We can.
I missed that. So we have another public hearing under Land Use and Transportation to legalize a portion of the Southwest Mountain Home Road as County Road 2226.
Great. And I'm going to turn to John Kidd, should be on Zoom, and I believe Stacy Shetler, our county engineer. Oh, I see Stacy. I think Stacy's going to walk us through a staff report for this one, and we're happy to answer any questions.
Hello, Stacy.
Hello, thank you. Can everybody hear me?
Yes.
Yes. Excellent. Well, thank you, Chair Harrington, Commissioners. Again, I'm Stacy Shetler, County Engineer with Land Use and Transportation. Before you today is the matter of legalizing a portion of Mountain Home Road, County Road number 3326. Mountain Home Road runs south of the Shoals community between Oregon Route 219 and the Yamhill County line. The road is owned and maintained by Washington County, and there is uncertainty as to the location of a portion of the legal roadway between just west of Schmelzer Road to Wonderly Canyon Road. This uncertainty was realized as a result of a recent paving project on Mountain Home Road. Note there is a misspelling of Wonderly Canyon Road on the survey in your packet that will be corrected in the official filed survey. Research and analysis of the record documents along with survey field work concludes that a portion of the legal right-of-way cannot be accurately surveyed and that a portion of the record county road notes do not conform to the traveled roadway. The portion of Mountain Home Road that is proposed to be legalized was originally established as a county road in the year 1875, and based upon maintenance records, survey records, fences, and other features in the area, this road has been traveled in its current location for over 100 years. Oregon Vice Statute 368.201 provides that a county governing body may initiate proceedings to legalize a county road if the location of the road cannot be accurately determined due to either numerous alterations of the road, a defective survey of the road, or if the road as traveled and used for 10 years or more does not conform to the location of the road described in the county records. This roadway meets the criteria for legalization. There are no permanent structures that predate the traveled alignment in the proposed right-of-way. The adjacent property owners were notified And to staff's knowledge, there isn't opposition to the legalization. There was an inquiry this morning about a church sign that after a quick review doesn't appear to be a problem and should be fine for the time being in its current location. The action today doesn't affect the church sign placement. It merely solidifies the location of the public right-of-way. So based on the foregoing facts, staff requests your board first conduct a public hearing and second approve the resolution and order. This concludes the staff report, and I can take questions at this time.
Do any commissioners have any questions for staff at the moment?
I guess there will be some follow-up, but I understand there was a correction on the Exhibit A that's part of the a proposal for approval today.
Yes, that's correct. It's been updated in the online packet so that we have the correct map there. There was an error in the earlier published version of the packet. So.
Okay, so so I take it that the correction is as evidenced by this
That's
handout?
correct. Yes, that is the correct map. Thank you.
Great. All righty. So with that, I'll open a public hearing. Ms. Jacoby?
We have none, Madam Chair.
We have no one signed up. Is there anyone in the room who wishes to speak on this matter? Seeing none, I'll close today's public hearing. We have...
Move for the requested action.
Great. We have a resolution and order in front of us. We have a motion and a second to adopt that, to legalize a portion of Southwest Mountain Home Road as a county road. All those in favor, please vote by saying aye.
Aye.
Any opposed? The motion carries unanimously 5-0. Thank you. And now we'll move on to our third public hearing for the day. This one from Health and Human Services. Great. So last week we held our first reading. So this week we're going to have our second reading of this ordinance. Do we have a motion to read Ordinance 870 by title only?
So moved.
Second.
We have a motion and a second. All those in favor, please vote by saying aye. Aye. Any opposed? Motion carries unanimously. Mr. Anderson.
Yes, ordinance number 870, an ordinance amending chapter 8.32 of the Washington County Code relating to emergency medical services, EMS.
Thank you. So before we start our public hearing, we'll see if we have a staff report.
Good morning again, Chair Harrington and Board. Marnie Kyle, Director of Health and Human Services. This is a short staff report. So the Washington County Code for the Emergency Medical and Transportation Services, 8.32, provides the authority and oversight for emergency ambulance, non-emergency ambulance, and wheelchair car transport. This code, as well as other county regulatory documents, are currently under review and they are in need of significant updates. These updates are necessary to assure accuracy with state regulatory documents and to accurately reflect current standards of practice and our future goals. Despite the need for more significant update, there is an immediate need for a minor update to recognize the EMS Alliance as the official county-approved entity for reviewing governance documents, EMS standards, metrics, and protocols, and providing recommendations to the EMS office and the Board of Commissioners. So today we are seeking the Board of Commissioners approve the proposed minor amendments to Code 8.32. And that concludes my report.
Thank you. And I will add that we did have a work session as well as multiple opportunities to meet with our staff regarding any questions that we had on this matter. So without further ado, I'll open a public hearing.
We have no one scheduled to speak.
Is there anyone in the room who wishes to speak on this matter? Seeing none, I'll close the public hearing. What are the wishes of the commission?
I move that we adopt the proposed ordinance 870.
Do we have a second?
Second.
We have a motion and a second. Given that this is an ordinance, could we please do the roll call?
Yes. Commissioner Willie?
Yes.
Commissioner Rogers?
Aye.
Commissioner Treese?
Aye.
Vice Chair Scouten?
Aye.
Chair Harrington?
Aye. The ordinance 870 passes unanimously on a vote of 5-0. Thank you. Excuse me, it looks like I have 2 copies of this next item, or that item. So we'll move on to an item under support services to approve the resolution and order to adopt policy T310. This one will be a resolution and order, so I'll turn it over for a staff report.
Good morning, Chair Harrington. Good morning, Commissioners. For the record, my name is Jack Liang, Director of Support Services. I'm with Eva Labonte, Assistant Director of Support Services, presenting to you today on the policy T310, Phase 2 response to novel coronavirus COVID-19. And I will pass it on to Eva to provide a brief staff report.
Good morning, Chair and Commissioners. We have under Personnel Rule 1.4 the ability for our county administrator in a declared emergency to create temporary policies, which during COVID has certainly come in handy as things had to move very quickly. We had a version of this policy in Phase 0 approved by the county administrator. Also, we are currently in Phase 1 version of this policy, also approved by the county administrator. Clearly, we've heard today that we're nowhere close to moving into Phase 2, but we want to be proactive. So that is why we are bringing this policy to your board right now, because we would like to, when we have the opportunity, to give you a chance to approve it without using our temporary rule to allow the county administrator to approve it. So this policy is to help take care of our employees. We are continuing to encourage our staff to work remotely whenever possible. Certainly, we have a percentage of our employees who have to be on site, and we truly appreciate their efforts and their work to work on site. So this policy does go over that. Also offers ability to have redeployment opportunities for people who can work in different areas when they can need to stay home, but can also don't have enough work to do. The main thrust of this policy is allowing our employees who are ill or quarantined or have family members or household members who are ill or quarantined with COVID-19 to remain at home and receive pay, not using their sick or vacation accrual banks. We certainly want to take care of both the staff that are ill, their family, and also encourage them to not come to work when they're in that ill state to take care of the rest of our employees. So that is the basis for this policy, and we are asking that your board approve the resolution in order to make this policy effective until the end of the emergency declaration or until we move out of Phase 2. Again, this won't be effective until we're in Phase 2, but we're just being proactive at this point.
So we recommend your board to conduct a public hearing and consider adopting this policy.
Commissioners, do you have any questions? It is nice to be able to get to one of these outside of the emergency provisions.
I have a question. My question is what's the fiscal impact and how's that being paid for?
It's a very good question. So we definitely anticipate for departments to use existing department budget to absorb as much the impact of the leave time as possible. However, it's hard for us to project if there is going to be any overtime requirement, if there's going to be any backfill type of requirement. But at this moment, we're not hearing significant feedbacks from the department that there will be such a need with this policy.
I still don't understand. I understand the policy and understand why. I don't understand the fiscal impact. What's going to happen in January? I don't understand how on overtime, can I take leave but still draw overtime? You're saying no. I suspect you have to be actively involved, so I'm assuming that. Is this CARES money that is going to pay for this until 12/31, and then we're going to have to look at what we're going to do on a budget? Or does our current budget carry us all the way to June 30th?
So it is, we're definitely utilizing CRF funding to cover COVID-19 related leave. before December 30th. And after December 30th, it will be part of our financial plan for continued COVID-19 response effort, which will not be, the CRF currently will not be a part of that financial plan.
The reference to overtime was for someone else who is covering that work. If those individuals have to go on overtime, so covering the origin of that cost goes back to covering for another employee who would need to stay home because either they're sick or someone from their family household is sick and they need to continue to self-isolate.
That's correct.
Correct.
Well, but just to clarify your point, Roy, this doesn't come into effect until we're in phase 2, and as we heard earlier today, phase 2 may not be till February, which would take us beyond the CARES money availability. So again, to Roy's point is, what is the anticipated, I mean, we don't have any way of even projecting what this cost would be, do we?
Really
Not to an accurate point. I mean, it's our wish to have 0 of our employees to feel ill or have the need to take this leave, but we really don't have any good way to project at what level we're anticipating that. Yeah, based on our current experience, we feel that the cost burden to the organization will not be significant.
There's one thing to consider is that if we didn't have this policy, people who have sick leave would be using that, and that's an unfunded liability paid for out of the department. So at this point, this is protecting their sick banks, but also helping people who have either of their new employees, they don't have a large sick bank, or they have had to use it for other reasons. So a lot of the departments would be paying for their employee anyway if they were using sick accruals. So it kind of falls into that category where if they had the accruals, they'd be using those, or they'd be using them anyway.
So,
just one final comment. I'm not certain I'm in favor, honestly, and it's not because I'm insensitive to the population of our employees. That's not the issue. We're preemptively doing something, you've already said that, so that we don't have to come back for an unknown quantity of money that we don't know. My gut tells me that we're going to have some significant budget issues in the coming year. I think it's just premature. I really do. I'd rather deal with what I have to deal with at the time that I know the amounts than to say, well, I think it's a nice thing to do, and I agree. And I think it's nice to be preemptive, I agree. But preemptive without any quantifiable numbers or knowing what the fiscal impact is, it's just, for me, the wrong thing to do, so.
I understand your point, Commissioner Rogers, and I appreciate your raising it. But the fact of the matter is, we'll never have set numbers because this is about the incidence of COVID by our employees or their household members. Now, we can possibly gather information about what the experience has been like for these past 7 months and try to estimate what it could possibly be for the calendar year or for the remainder of the fiscal year. But it would still be an estimate. It's not like a known piece of equipment or having a known number of staff members to work on a particular project for some set time period. So I think my understanding, based upon the experience of the organization to date, is that we have reserves coverage for this as well, for costs on this, and that based upon our experience of these past 7 months, if we take that experience and project it out for the 6 months from January 1st to the end of June, we are well within our fiscal capability to handle this, while at the same time we continue to ask all of our employees and all of our community members to take measures to reduce the exposure to the virus. I think that's really the best we can do.
I have a comment too. My understanding is that we have side rails built into this, that it's for COVID, it's for phase 2. So there's parameters around this that limit the exposure, for lack of a better word. I'm also comfortable that this is the prerogative of the CAO in relationship to what the situation is. Is that correct?
Yep, as far as where we are allowing the county administrative office to approve the policy?
Yes. Okay. And I'm in favor of being prepared now instead of waiting until we get to phase 2. I understand where your concerns about the exposure level, what the fiscal exposure is, but we will not have good information even when we're on the eve of phase 2. So we won't know any more then than we know now. I don't believe in terms of long-term status of phase 2 or the rate of exposure. So I am in favor of taking a responsible position to put this into place now so that we're prepared when the time comes.
And I apologize for not clarifying better with the information. As Eva explained that the alternative of the COVID-19 leave would be our regular sick leave. So from a fiscal perspective, the difference really wouldn't be significant, and those are all budgeted costs within each department's budget. And that's why we're not anticipating the hard fiscal difference is going to be different from an employee taking sick leave instead.
I said that was my last comment, but I will respond, and that is that one of the ways that we're making this achievable is the use of CARES Fund, and you've admitted that. There are many, many organizations, and everything from childcare to nonprofits who would love to get some more CARES funds. We're using that internally because we're unwilling to say you have to take some of your sick leave. So there's a cost, and it may not be a projected cost, as I think both the chair and the Commissioner Teresa pointed out, but there's a cost to the public. And I just feel uncomfortable personally, and so I've said enough.
Thank you.
Shifting dollar availability.
That's
is
yep,
what it boils down to.
Yeah.
I guess I'm not, again, based on the report that we heard, that phase 2's in the distant future, I'm not sure that I think we need to do this now. I mean, it's October. We're talking about February phase 2. We're talking about being done with CARES funds if they're not extended. I would much prefer to have a better perspective of this. But as Commissioner Teresa pointed out, it is a tool we're giving the CAO, not a mandate. So I'm okay at that point in time as long as we have further conversation before that tool is implemented.
Chair Harrington, if I can respond. So I've heard from the board also a request for data to really look at what our experience with employee COVID cases are and what that fiscal impact is. And I'll also say a work productivity. I appreciate the comments on having tools, because this is about protecting our workforce too, and having tools in place so individuals stay home and not come to work is very important as we embark not only COVID, but also the flu season. So I will work with Director of Support Services and Assistant Director to collect that data and be reporting that out to the board as we move forward on employee workplace utilization.
We are currently tracking that data.
Okay.
So it is possible that we hold the public hearing today, but delay further action on this to a later time if we want. That is an option, right?
I would love that, just to get some more information. I'm not, I like the concept. I think we can flush it out, that's fine. But if the board wants to go, that's fine.
Should we still proceed with the public hearing today, or should we wait?
You've already scheduled the public hearing, so you should probably hold it right now.
Yeah, let's do that.
All righty. Are there any other commissioner questions on the staff report?
Yeah, I would be in favor of course, of conducting the public hearing that's been scheduled and then continuing the matter to a date, perhaps date certain.
I will support that if I understand what the date certain is, because we've talked about February for phase 2, but, you know, I think we've got like a 3-week window when things could change. Isn't it? No, that's for school districts, excuse me.
No, you're correct.
Is it? Okay, so
would have-
we'd only have 3 weeks if we could move into phase 2 earlier. I'm not, you know, the projections certainly don't look like that, and I understand that. But I just don't want us to have this put so far out that we don't do what we're asked to do here, and that is to be prepared ahead of time.
Maybe I might suggest November 3rd.
I'm comfortable with that, thank you.
I was thinking more the end of November to give you time to do what you got. You're doing a lot of things with a skeleton crew, but by the end of November. I don't know if that's acceptable to others.
I would ask for feedback from our county administrator on those 2 dates.
So I would suggest that we come back, November 3rd would work, otherwise December 1st.
My preference is November 3rd.
We have a very full agenda on November 3rd. Just a really large work session agenda. And so that is my concern.
You live at December 1st?
Yeah, our meetings in November, our last meeting of the month is November 17th. So our first meeting, I'm just verifying, our first meeting in December is December 1st. So I think it would be a more prudent course of action.
Again, I'd ask the county administrator, are you comfortable with December 1st? And Mr.
Yes.
Lang?
Yes, we can definitely accommodate that.
Okay, I'm fine then, thank you.
Okay, so we've had a staff report. So at this point, I will open a public hearing on this resolution and order. Ms. Jacoby, do we have anyone signed up?
I see no hands. Thank you.
Is there anyone in the room? Seeing none, I'll close the public hearing. I would ask for a motion at this point to continue this item to date certain, December 1st, and at which time we'll have some further information and we'll have then a motion to adopt the resolution and order. Okay?
So moved.
Is there a second?
Second.
We have a motion and a second. All those in favor of the motion, please vote by saying aye.
Aye.
Opposed? The motion carries unanimously 5-0 for us to continue this item to date certain, December 1st. Thank you, commissioners. Phew. And just to reiterate, we had pulled the other public hearing under support services. So next, we'll move on to our second oral communication session. Ms. Jacoby, do we have anyone signed up for this?
I believe Dale Feek would like to continue his comments. So give me one moment and we will pull him up.
Mr. Feek, can you hear us? Dale, are you there?
I am. Am I unmuted now?
Correct, you are. You have 5 minutes, sir.
Thank you. It's a little confusing because I signed up for 2 minutes before the meeting on oral communication unrelated to public hearing. There's a little bit of problem solving that needs to occur because of that. And I'll work with staff to get that resolved. So, so I'm going to go ahead and do my 2-minute oral comment now, but I'll have 5 minutes to do it. So that's great. So, Madam Chair Harrington and county and other commissioners, I'm Dale Feek, Chair of Washington County Citizen Action Network. And usually when I send you emails, I usually put who it's CC to, and I always include, not always, that's a funny word to use. I usually, most of the time, use a CC to our board of directors. And so one of the decisions that we made at one of our board meetings is they authorized me to be the official spokesperson for WC CAN. And one of the things that they wanted me to do is always email them my written comment if I send you written comments, so they will know at least what I'm doing, and then they can disagree with me as we commonly sometimes do. So anytime I speak, when I say Chair of Washington County Citizen Action Network, I'm speaking as chair and as the spokesperson for the board. Just want to make that clear. And so I sent you, when I make oral comment, my understanding at the 2-minute and at the end of the meeting, the 5-minute comment, all you have to do to sign up to do that is say what your topic is. You don't have to send any written comment at all. But I usually do because I want to give you a head up, and then I want to summarize usually my written comment because I think it's more effective and sometimes more efficient. So I just wanted to clarify that. So my public oral comment now has, and I sent you an email on this and CC'd it to different people. And so I listened to the October 13th county work session about state climate adaptation framework. So I'm asking you to please reconsider your decision to not take a lead in fighting climate change and to hold back to see how the state of Oregon sorts it all out with their climate adaptation framework. Not take a lead. I want you to take a lead. Commissioner Pam Treese, you became informed about the urgency of the climate crisis after you participated in the Youth Acting for Our Earth event, in which 2 of those youth, that's Isaac Bergen and Miko Bergen, informed you, or at least one of them, and their mother, Pam, informed you of the climate crisis and asked for your support. In a video recording of that, or at least a recording, you made strong statements saying that you would do so. And in my email to you, I gave the links to Youth Acting for Our event, the Earth event, that's the general climate change recovery, and then also the specific one for Isaac and the specific one for Miko. Now the Bergen family, that's Rob, Pam, and the 2 daughter and son, and the son is older than Miko, lives in your district, Commissioner Dick Scouten. Isaac and I spelled her name right here, in the Miko, are 2 of the 21 youth who are suing the federal government over climate change to ensure that the legal right to a stable climate is protected. Isaac, Miko, and other youths stated, in quote, big dark print, "We're never too young to lead." I'll repeat. They say, we're never too young to lead. I say, I would hope that you are never too old to lead. I'll repeat that. I hope that you are never too old to lead. At the Clean Water Services Advisory Committee meeting on October 14th, Jan Wilson, who tried to make the presentation to Bob Baumgartner visually, it didn't work, but you got the point. She's the executive director of Tualatin River Keepers and a member of the Clean Water Advisory Committee, CWAC as they call it. She made very strong statements that Clean Water Service should do everything it could to address climate change. I listened to those meetings. I guess I just have to summarize saying, Deke Gunderson is going to have Miko and others at his class. If you're interested in participating in Zoom, let me know. Thank you very much.
Thank you, Mr. Feek. And I just want to clarify, with the development of the state climate adaptation plan, Washington County has been involved in planning for climate resilience for a number of years. And I know this because of my time as a Metro councilor. So I know that I look forward to the state providing clarity through their work in developing a state-level climate adaptation plan so that we can have a little bit more certainty about what we should aim for. So we are by no means pausing our efforts. We're just ensuring that the state is taking the lead in, at this stage of the game, for the additional requirements as compared to all the other programs that the state has set out to date. So thank you very much. Okay, that's it for the oral communication section of this meeting. Next is board announcements. I will just note that we have one more meeting remaining in the month of October. That's next Tuesday, the 27th. We have a work session starting at 1 p.m. in the afternoon, a little bit earlier than normal, and we have a board meeting that evening starting at 6:30. November will be a little bit of a compressed month. We have our set of work session and board meetings starting in the morning on Tuesday, November 3rd. And that is election day. We want to make sure everyone gets their ballot in by 8 p.m. We have a roundtable on November 5th. Then Tuesday, November 10th is an extended work session day, no business meeting that day. And then our last board meeting set of the month is on Tuesday, November 17th, with a work session in the afternoon and a board meeting in the evening. So that's it for the standard board announcements. Does anyone else have any other board announcements at this time? Okay, seeing none, that's the end of our meeting. Do we have a motion to adjourn today's meeting for October 20th, 2020?
Second.
We have a motion and a second. All those in favor, please vote by saying aye. Aye. Any opposed? The motion carries unanimously, 5-0. Thank you.
Is it?